My name is Dr. Chinelo Animalu, and I am an infectious disease specialist out of Methodist University Hospital and a professor of medicine, Division of Infectious Diseases at UT College of Medicine.
Thank you. Good morning, everyone. Thank you, Dr. Folari, for having me join this initiative. It's something that's very dear to my heart as a practicing clinician of infectious disease, and part of the difficulties that we face from our everyday practice would be management of patients with infections with multi-drug resistance. The objectives would be to discuss the history of antibiotics and emergence of antibiotics resistance, as well as factors that are associated with the emergence of multi-drug resistant organisms in the modern day era. So what I wanted to do was to kind of give everybody a brief background of antibiotics, how we got here, and the things involved. So before we go into, everybody knows that Dr. Alexander Fleming is considered as the grandfather of antibiotics. But prior to that, I kind of wanted to give us what it was like in the pre-antibiotics era. So dating back to like 2500 BC, that was, times of ancient civilizations, there was use of antimicrobials, in the medical field. In those days, they were using like moldy bread, that's bread with mold. The seven was when we had that concept of antibiotics, basically, and this was discovered by the famous guy, Pastor Louis Pasteur. And what happened was that it was just the concept of biological process where they noticed that one organism would inhibit the growth of another organism. And that kind of brought us to where we are in terms of discovery of antibiotics. Around 1900, there was search for antibiotics. And back in 1928 was when Sir Alexander Fleming, discovered penicillin. So this, and he discovered that in his lab, where he noticed that a petri dish that had contained Staph aureus kind of was cleared by this particular mold that was called Penicillium. And what he did was to try to kind of work on this organism and see the properties it had, which led to the discovery in 1928. And it wasn't up until around 1940s that penicillin became widely available, all over the world. And immediately this happened, there was resistance immediately to their antibiotics. So they noticed that a bacterial enzyme called penicillinase was identified, and this had carried with it resistant strains that made it impossible for penicillin to work in those patients that were noticed to have this strain. And if you go all the way back to, the discovery of streptomycin around the 1944 era, this was used to treat tuberculosis in that time. The moment that streptomycin became widely available for use in treating TB, they noticed resistance amongst patients that were also being, where this antibiotics was being used. So what you can see is that the issue of resistance has been there, present from the inception of antibiotics. And so as other antibiotics were discovered and introduced into clinical practice, they also noticed the same events. So over time of this antibiotics era, the number of identified resistance mechanisms also increased at an alarming rate. So since the discovery of penicillin, there have been many more classes of antibiotics that were discovered between 1950s and 70s. And this is kind of, called the golden ages, which I'll talk about in a second. And that was basically the times that where majority of antibiotics that's being used in medical field today was discovered.
My name is Dr. Chinelo Animalu, and I am an infectious disease specialist out of Methodist University Hospital and a professor of medicine, Division of Infectious Diseases at UT College of Medicine.